Hello everyone, I'm Tanvi Mahawar with a deep curiosity about microbiome and its incredible role in human health. Today, we will dive into an exciting and complex topic, the gut microbiome and its links to cancer. We will also look at how high-fat diets and drug microbiome interactions come into play. So let's get started. The gut microbiome, a complex ecosystem of trillions of microbes residing in our intestine, plays a crucial role in metabolism, immunity, and overall health comprising bacteria, fungi, viruses, and archaea. It maintains intestinal homeostasis, modulates immune responses, and influences systemic health. This biases or imbalance in microbial composition has been linked to various disorders, including metabolic disease, autoimmune disease, and cancer. External factors such as diet and medication significantly alter gut microbiota, impacting disease susceptibility and treatment outcomes. A high fat diet, HFD, disrupts the balance of gut microbiota, leading to an increase in pathogenic bacteria while reducing the beneficial species such as bifidobacteria and lactobacilli. This shift can promote pro-inflammatory environment, predisposing individuals to cancer. Chronic inflammation is a major driver of cancer progression. HFD has shown to elevate levels of pro-inflammatory cytokines such as TNF alpha, interleukin 6, interleukin 1 beta. These cytokines contribute to the formation of tumor-promoting microenvironment by supporting angiogenesis, cell proliferation, and immune evasion. Dietary fat alters bile acid composition, promoting the growth of bacteria that converts primary bile acids into secondary bile acids. Secondary bile acids such as deoxycholic acid has links to DNA damage and increased risk of colorectal cancer. A high-fat diets promote the translocation of LPS, lipopolysaccharides, from gut into circulation, leading to microbial endotoxemia. LPS triggers immune activation, oxidative stress, and insulin resistance, which collectively contribute to cancer progression. Certain gut bacteria metabolize drugs into active or inactive forms, influencing their therapeutic effects. For example, Igarthella lenta inactivates digoxin, a cardiac medication affecting its potency. Broad-spectrum antibiotics disrupt gut microbial communities, leading to increased susceptibilities to infection, antibiotic resistance, and metabolic disturbances. Some probiotics enhance drug absorption and bioavailability. For example, specific bifidobacteria strains improve chemotherapy outcomes in cancer patients. Differences in gut microbiota composition contributes to varying drug response among individuals, emphasizing the need of microbiome-based precision medicine. Immunotherapy, particularly immune checkpoints inhibitors (ICIs), has evolutionized cancer treatment. Responses to ICIs vary significantly with emerging evidences suggesting that gut microbiota plays a vital role in treatment efficiency. Certain gut microbes enhance immune response by modulating T cell activation, increasing the rate of immunotherapy. Specific bacterial species such as Akkermansia muscipula has links to improve response in immune checkpoints inhibitors. The use of antibiotics disrupt gut microbial balance, reducing immunotherapy effectiveness. Patients who receive antibiotics prior to immunotherapy tends to have poorer treatment outcomes. Short-chain fatty acids produced by gut bacteria influence immune cell activity, enhancing the body anti-tumor response. Fecal microbiota transplantation (FMT) from immunotherapy responders to non-responders has shown a promise in enhancing treatment efficiency. Personalized interventions targeting gut microbiota could improve immunotherapy success rate, making microbiota analysis a crucial component of oncology. Future research aims to develop a precision probiotics that target specific microbiome composition, identify microbiome-based biomarker for early disease detection and treatment response prediction, explore prebiotics and postbiotics as adjunct therapies to mitigate adverse effect of high-fat diets and certain drugs, integrate microbiome analysis into clinical settings to enhance treatment personalization. Advanced microbiome-based interventions in immunotherapy could improve cancer treatment. Understanding the interplay between gut microbiota, diet, pharmaceuticals, immunotherapy will pay the novel therapeutic strategies and precision medicine. In the last, the gut microbiota is a key determinant of health, influencing disease risk, drug metabolism, and cancer treatment outcome. The studies reviewed highlight the importance of dietary interventions, pharmaceutical awareness, and microbiome targeted cancer therapies. As research progress, integrating microbiome insight into clinical practice will revolutionize healthcare, leading to more effective or personalized treatment. Thank you for tuning into Microbial Horizons. Stay curious, stay informed, and don't forget to take care of your microbiota.